Let's talk about Smart Lipo. Is Smart Lipo really smart? Laser lipolysis is the latest technology used to treat excess fatty deposits. The first laser to come out to treat fat, and the one that is most well known, is called Smart Lipo. The amount of awareness for liposuction has skyrocketed since Smart Lipo was launched. The reason for this is that it has been heavily marketed as the latest advance, and as a procedure that can be done in the office with only local anesthesia. There is actually very little, if any, good research showing whether Smart Lipo is effective. Most plastic surgeons have learned to be skeptical of new technology that is not backed by good research. Smart Lipo was originally designed and marketed to treat just small areas of fat, such as in the neck. It is marketed as something that could be done in the office with the patient completely awake. Because of this, many non-plastic surgeons who don't have access to accredited operating rooms decided they could do this procedure in their office, and overnight they decided to become cosmetic surgeons. The initial lasers that came out, the lasers that many of these doctors bought, actually have very little power, perhaps 6 to 10 watts, and are not doing that much to the fat. Now there are newer lasers that have more power, maybe 18 to 30 watts, which may be doing more to melt the fat. However, with this increased power comes more risk and more pain. You can't use these strong machines with a patient that is completely awake. The reality then is, if you want Smart Lipo with a machine that is actually doing something, you need to have one with more power, and you're going to need to have at least strong IV sedation or general anesthesia. The procedure is usually done first with tumescent anesthesia, which is injected, and then the laser part is done, and then the fat is removed with a regular old suction-assisted liposuction cannula. The question arises whether the laser is really doing anything significant that would not be done with the regular liposuction alone. Now there are some claims that the skin is tightened by the laser, but this has not been proven in any formal research study, and the photos used in advertisements are not really that impressive. In summary then, Smart Lipo has been greatly marketed and everybody seems to want it. However, the jury is still out as to how effective it truly is. As far as this being the lunchtime lipo, where you can be totally awake for the procedure and have a quick recovery, that's only true if a low power machine is used and very little fat melting is actually going to happen. Again, the truth is that with any type of liposuction, this can be done with the patient awake if that's what they want. The amount of discomfort you have during the procedure is more a function of how much fat is to be removed than in what technology is used. How quick the recovery is similarly determined by how much fat is taken out, not so much by how it was taken out. The bottom line is, if you are interested in liposuction, the most important decision to make is not what type of liposuction you're going to have, but which surgeon is going to do it and what their experience is. In many cases, ultrasonic or regular suction-assisted liposuction will work just as well or even better than Smart Lipo. So don't be fooled by all the hype and marketing. Choose a board-certified plastic surgeon that is experienced in liposuction, and they will direct you toward the best procedure for you. Best of luck.